Deanna Hansen is a fascia expert, best-selling author, and speaker. She is the founder of Fluid Isometrics and Block Therapy, a bodywork practice that is therapy, exercise, and meditation all in one. Deanna's passion is to help people understand how their bodies work and provide a system to tap into their innate intelligence. From those with debilitating issues to the elite athlete, this work can be modified to address any situation. Deanna teaches you the process of releasing the adhesions, oxygenating the cells, and rebuilding postural foundations, which is critical to releasing pain and trauma, managing size and shape, reversing signs of aging, healing acute injuries, accelerating recovery, improving physical performance, and maintaining overall mental and physical health and wellness. Recently, Deanna has partnered up with Dr. Marlene Siegel to incorporate this important fascia work for pet care. Welcome, Deanna. We are absolutely thrilled to have you here today.
Thank you both so much. I am so excited to be here.
You are an expert in an area that we have not dived into yet on the summit. So let's start at the beginning. What is fluid isometrics? What is fascia? How did you get into this? All of the things. Let's start with your story, because I think folks are really going to resonate with how you came to be where you are.
Okay. It's really actually a very exciting journey. It's also been wrought with pain, which I think a lot of us, when we start these different modalities to assist other people, it really comes from our own suffering. So back in my 20s, I was training to be an athletic therapist, and I was working with professional athletes. And at the time I was doing what I was trained to do for my own self, but my physical body didn't seem to be responding. I was 50 pounds overweight, struggling with anxiety, depression, chronic pain. And the harder that I worked, the worse I became. From the perspective of weight loss, it was like, okay, the rules of weight loss don't apply to me. And then the harder that I worked, that also brought in more compression in my body, more constipation, more anxiety. And then that just became this defeating journey that I was on, because it wasn't as though I wasn't working really hard. By the time I turned 30, I made some major changes in my life, and those changes resulted in severe panic attacks. However, this was the seed of everything to come, because in a moment in time, in one anxiety attack in particular, I actually thought I was going to die. I was literally frozen with my breath, frozen with fear. And for some reason, I intuitively dove my hand into my abdomen. And in that moment, I let out a gasp, an exhalation, and I connected to pain. But the pain brought me out of my crazy thinking. It brought me to the ground. So I felt calm and safe in the moment. And I just continued to intuitively explore in my abdomen with my hands. Up until that point, for probably 8 years at that point, I had been focused on deep tissue work as the athletic therapist. But I never worked in my own body, and always avoided this area, because that's where I stored, it seemed, all of that extra 50 pounds of weight. So I literally hated that space of my body. So now I'm diving in, and I'm encountering this pain and this tissue that felt like scar tissue that was marbled throughout, even though I didn't have any injury or surgery in this area. So I continued for that first evening for about 35 or 45 minutes, just to intuitively explore. And what was just so obvious to me was how calm I felt. I woke up the next day a little tender from the work I had done. And then I was really excited, though, to get back after working on patients all day to continue in with the work, because I noticed how calm I was feeling, which was such a new sensation for me. So after the second evening, when I came home and I did the work, when I stood up, I felt taller. And I went and I looked at myself in the mirror, and my belly was flatter than it had looked in years. Now, in my 20s, when I was really trying to change my body, I was doing 400 sit-ups a day. I was doing Tai Bo. I was training to do a half marathon, aerobics, weights. I mean, you name it, and I was trying to do it. And the harder that I worked, the bigger my body became. So for something to make such a profound difference within 2 days, literally at my fingertips, this became my day-to-day practice after I would come home from working on patients. And after 2 weeks, my chronic low back pain was going away. Other changes were happening, but I was just waking up really excited about life. So I started flipping my patients onto their backs. I started intuitively working with them, and I started having amazing results with patients as well, which attracted other body workers to learn my technique, which I now call fluid isometrics. So that continued for a little bit of time. And I was really diving into this tissue in others and myself and really connecting a lot of dots that I don't think that a lot of people have made connections to. So what I really learned over time is fascia is really the surface cell membrane of every other cell membrane interconnected through this matrix. It's the communication system between every single cell in the body. So literally, the fascia is here to provide protection, communication, and stability, and to do all these amazing things to support cell health. Now, what we as humans need to do is understand how to support the fascia system, because if we go through life in an unconscious way, gravity is going to be the main force that drives us down toward the earth. But combining that with unconscious posture and unconscious breathing, we essentially are allowing gravity to drive how we go through time, how our body ages. But the very exciting thing is we don't have to allow that if we understand how to approach our fascia properly. And even more exciting is no matter where we're starting from, we can actually dive through those layers of fascia to melt through the scar tissue and the adhesions that developed over time, which block blood and oxygen flow to cells, to awaken cells previously blocked, which allows us to undo pain, aging, disease, release emotional trauma that's been stored in the body, and really chart a completely different course for how we go through time. Did that make sense?
Wow. Yeah, absolutely.
Okay.
And
Cool.
I'm interested to hear a little bit more what ended up happening with your journey. So you started seeing improvements really quickly. What did that look like?
Well, the very first thing was I started changing my size and shape. Like my whole physical structure began to change. But also I had a really significant issue with anxiety. And I used to label myself as having anxiety. What I've now learned along the way is I didn't have anxiety. I had cells that were anxious because they weren't being given what they needed to do their job for us. There's a video called Life of a Cell by David Belinsky. And every time I watch it, it literally brings me to tears. In every single one of our trillions of cells that make up our body, there is an absolute universe of activity taking place in these cells. And when you watch it, it's absolutely fascinating. And to think that there's trillions of these working to allow us to thrive in life gives you a completely different perspective of how we treat our bodies, especially how we beat ourselves up because of our bodies. And it's like the cells are like these little puppies that just want to give us love. And yet we're beating them up all the time, whether it's through how we work out, exercise. I mean, people often ask me what's the most detrimental thing we can do to our fascia. And honestly, exercising in an unconscious way is probably one of the top things that I would put up there as being something that's going to drive us further into the aging process. So when we can really understand how to support cell health, it absolutely changes how we view our bodies, how we speak to ourselves, because even the frequency that we put through our bodies, if we're constantly hating or shaming ourselves or others externally, we're actually putting a frequency of energy through that fascia that negatively affects every one of the cells. So that's really the significance of this fascia system. It literally is the connector of all things. And we can be unconscious and then gravity does what it does as we go through time, or we can truly own our fascia system and apply appropriate measures to go through time without time accumulating in our tissue. And we can even take the time out that has occurred through time. And what really we lose is space. So gravity compresses us. We become shorter and wider. I think most of us that are of a certain age or older, we recognize that this happens. So as I get older, gravity's compressing me. What's happening is the fascia is here to keep us upright, but we're dominant on one side. So I'm right-handed. So typically that right-sided person, 70% of the population are right-handed. We end up torquing constantly to keep that right side free for action. And that creates an imbalance in the body. So the fascia will literally grip and adhere to anything in its path, ultimately to bone, to create that stability. And it will do that with a force up to 2,000 pounds per square inch. So we literally get magnetically sealed in our negative alignment. And then the denser we become, the faster gravity grips us and continues to manipulate us and pull us down. And the more adhesions, the more cells that are blocked from blood and oxygen flow. And also the more the tissue in general becomes acidic because of the stagnancy of that lack of flow in the body. And that's ultimately where that pain, aging, and disease comes from. So with the technique that we've developed, it's all about putting the space back into the tissue that time has taken away. In fact, there's 3 pillars. The first one is creating space through the melting of adhesions. With fluid isometrics, which is the technique that I named, that I've taught to other therapists, I teach them to use their hands. And what makes it different than gliding on the surface layers is we drive through the layers to get to the bone. And we follow the path of how energy moves in nature, which is based on the Fibonacci sequence, the spiral pattern of everything in nature. So if we just try to do linear strokes, we won't be able to get to the root of the issue. So whether using our hands or using the tool for blocked therapy, with this, we teach people how to lie on the tool and very slowly drive through the layers of fascia using pain as your guide. So pain is really the language of the cell, giving us information that it needs attention. It's not something that we want to ignore. It's something that we want to move into and embrace. And it becomes a really efficient roadmap to healing when it's understood properly and you have a proper process for it. And then the second pillar is inflating the space that we've newly opened through teaching people proper diaphragmatic breathing. And actually, I'd love to talk more about this once I talk about the third pillar, because the diaphragmatic breath is really the most foundational piece of this whole process. And then the third pillar is maintaining or owning that new space created through teaching people proper postural foundations. And even the tongue muscle is a muscle that we need to understand, because it is also in part here to support the weight of the head. It's not just for talking and chewing, but if we don't understand what this muscle's purpose is, then we don't also know how to exercise it properly to really create that support in the body.
Wow. Wow. I just learned a lot. I just discovered why I can't do the splits anymore. Whereas when I was a gymnast, no problem, you know, it's like, oh, I got to get in there and do some spirals and all right.
Yeah.
So you mentioned a few things that I want to pull out and tease apart a little bit. You mentioned that the back and forth isn't as good as getting into the tissue. And that makes me think of foam rolling. We see foam rolling a lot in the athletics and fitness spaces where, but I literally have a foam roller here. So you have like a literal, I mean, this is a really hard one, but they come from anywhere soft to harder. And you would literally, you know, for someone who's never seen a foam roller, you would like lay on it, for example, and roll it along an area of the body. But what you're saying is this is not effective as using the block or using the hands where you can actually get in, which makes sense because this isn't getting in, it's going across.
Yeah, it's like the difference between having a boat and driving on the ocean compared to deep sea diving. And it's at the depth, at the bone, which is the root of what's holding us in that negative alignment. So, and even also understanding that there's cause sites to the pain. So for example, if I have a frozen shoulder and I go and I have a shoulder treatment, I might get some temporary relief because whatever they're doing in that space is going to be creating some improvement in flow temporarily. But when I look at bodies and I'm assessing them for where their cause sites are, the calves and the feet are always going to be major cause sites for absolutely everything up the chain, because it's all about tissue temperature. We need to have the proper temperature in our body for optimal flow to and from every single cell. So if I can just jump in and talk a little bit about the diaphragm here, because this all connects in. So the diaphragm muscle, it's a plate of muscle that sits right here. It's the foundation of the rib cage. When we're breathing diaphragmatically, this plate moves down when we inhale and it moves up when we exhale. And if it's working properly, it's constantly creating a massage to this whole space in the body. It's the ceiling to the abdominal organs and the floor to the heart and the lungs and everything above. So if we aren't breathing diaphragmatically, this foundation becomes weak and we ultimately fall in. And what happens when we fall in? We balloon out. And we also displace what's going on in through here. So this area becomes literally frozen because it's lacking that consistent massage effect from the diaphragm muscle. And that has huge implications of how we move fluids through the entire body. So the calves and the feet and the forearms and the hands are actually the furthest from the engine. So if I go in for that shoulder treatment and then I start walking and my left foot is pronated, collapsing in, it's going to be torquing that right shoulder. So I can have years of treatments on an area. And every time I step, I'm going to get pulled back into that negative fascia pattern from our foundation, because that's where we are the most frozen out of alignment. And then, of course, what happens through here with the hands and the arms, when we are in correct alignment, our palms should actually be facing in front of us. But if you look at anybody and everybody walking, the palms are typically behind. And then that causes internal rotation of the arms. And it also pulls the rib cage down, causing the collapse of the rib cage into the core. And then all of the organs in the core get displaced and we're not digesting properly. The liver is not getting the heat that it needs. So then we end up having fatty liver disease. The pancreas isn't getting the energy it needs, so we can have metabolic disorders. And we're also not going to be digesting and eliminating as well. So then we can get a backup of waste and inflammation in the gut. So all these things really come from the diaphragm muscle not working properly. Even the brain frequency is different when we're breathing diaphragmatically compared to breathing through the muscles of the upper chest. And here's the thing that's so interesting. Pain, fear, and stress cause us to reactively hold the breath. And if you see a deer, for example, who has survived an attack, you'll see it shake. It's letting go of this energy that came in, all of that adrenaline from the fear that would have happened in that moment. For people, we often go into freeze mode. So we might see a trauma, have a physical injury, pain, fear, and stress. We reactively hold the breath. If we don't let go of that negative energy in the moment and we stay in that freeze mode, then that's where we age from. And then that's going to cause us to pull in more and more of that negative emotion, because we're magnetic beings. And whatever the frequency that we are exuding, we're actually going to pull more in. So if we're holding fear, we're going to be pulling more fear into our lives. If we can let things go and we're really living in that present moment from a place of peace and love, then that's what we'll also be pulling more of into our life.
Wow. Wow. I just went into a place in my brain that I just kind of want to share. It's a little bit personal, but you mentioned, when you see a deer and it's frozen and then afterwards they shake, that really resonates for me. I experienced trauma of a physical nature several years ago, and I very much had a freeze response when it occurred. And when I started talking about it for the first time, I would uncontrollably shake to the point where my teeth would chatter. I could barely speak about it. It was so almost violent shaking. And so it goes back to what you're saying about impacting the physiology and trauma being stored in the body as well. And I just want to kind of draw extra attention to that, because it's something we say a lot, it's something we hear a lot, but it's very, very real. And what's traumatic for one person, it could be witnessing something happening to someone else. It could be experiencing it yourself, right? And so I just want to kind of give people the time and space to kind of reflect on that and think about, even if you've never had some kind of obvious injury, right? A frozen shoulder is a great example that you've been using. This could be relevant for you in a variety of other ways as well.
Well, and I actually just finished a 90-day trauma program with our community, and we had 12 additional speakers that we interviewed, and I learned so much through that process. And one of the things that really became so apparent is the big T's and the little T's can have the same effect, or those little T's can even be more detrimental in the effect, depending on what you do with those. So you might have an older sibling that like knocks you down, or says abusive things, or whatever that may be. Those little slights along the way, they can really add up and change your whole perception of how you see yourself, of how you live through life. And it's truly fascinating, the trauma aspect. And from my perspective, it really does come that simple foundation of the fact that whatever is occurring in the moment, if we're not allowing it to release, it gets stuck in the breath. And then that's how we move. So with the diaphragm, this is the muscle that sends the blood and like the heart pumps the blood and the oxygen to the body, but the diaphragm is really the powerhouse of making sure that the fluids are sent to all cells in the body. And if every single cell is receiving energy, blood and oxygen flow, then those cells communicate in the moment with the brain and we respond to those moments. But if we're riddled with adhesions and scar tissue, and the difference being scar tissue resulting from injury or surgery, adhesions more from a chronic perspective resulting from just the collapse over time of our alignment due to gravity and unconscious posture and breath. These are blocking energy to those cells. So now there's gaps in the system. So now those cells don't have the energy in the moment to share information with the brain. So now we're filling the brain in with a whole bunch of memory as opposed to seeing something for what it is in the moment. And I'll just give you an example because I really learned this when I was going through my yoga teacher training years ago. We were asked to do a bunch of reflection on our own life. And I happened to be walking through a mall and I was in a really great mood in that moment. And then this gentleman was passing me and we locked eyes. And the moment that we did, he scowled. And immediately my gut churned. I got that sense of, oh my gosh, of that horrible, yucky feeling. I suddenly felt acidic. But because I was going through this process with yoga, I stopped for a second. I said, holy smokes, like literally in a snap of a second, I went from feeling really good and light and happy to being just like, what is going on? And so I recognized that his glance reminded me of how my dad would look at me when he was disappointed in me. Had I not been able to say, okay, well, that probably had nothing to do with me. Maybe as he was walking toward me, he got a shot of pain in his knee and it just happened that we were looking at each other at that same time. And I made it personal when in fact, I didn't know this person and whatever, right? So had I not been aware of that, that could have changed the entire course of my day. I might have gone home to my family and felt really edgy and been in a very different mood than had I been in a happy mood. And how those little things can really impact our day. And then how that can spiral to become a bigger issue just from that perspective. So to really get a grasp on how our body responds through the breath and to be able to take control of the breath and change our course and start to feed these cells that have been blocked and clean out the inflammation, it can really change our entire approach to how we live.
I love as well how you said earlier that how we breathe will have an impact on the type of brainwaves that we're having. Can you just unpack that a little further? I'm curious.
Yeah. In fact, there's two great books where I really started to connect these dots. Stephen Cope, Yoga and the Quest for the True Self. He has a fantastic chapter. And he really dives into the difference between the diaphragmatic breather and the unconscious breather. And then Eckhart Tolle in The Power of Now. He talks about this as well. And it was through Eckhart Tolle's book, I believe, where he had shared that when we're breathing diaphragmatically, we're living in the moment. And that is connecting us to a relaxed brain frequency because it's connecting us to the parasympathetic nervous system. So we're relaxed. Where when we're breathing through the muscles of the upper chest, it's that sympathetic, stressed mindset. And if that's how we're breathing all the time, we can be in a situation where we're relaxed and calm, but our brain pattern and our physiology is still experiencing stress. And conversely to that, we can also be in a stressful situation, but if we're breathing diaphragmatically, we can keep our internal environment at peace and calm within so that we, again, have control, because we don't have control over what happens outside of ourselves, but we do have far more control than we realize of how we take that information in, keep what serves us, but let go which doesn't serve us.
Is there a little exercise maybe that we can all do right now to see, like, are we diaphragmatically breathing? Is this something we should be doing all the time or just kind of when we're focusing on it? What might that look like? Well,
if you look at a healthy baby when they're born, now I'm going to preface this by saying babies today are different than when I was younger. So I'm 53 years old right now and the world has changed, but a healthy diaphragm, when you inhale, your belly should become nice and big. And when you exhale, your belly should become small. When I was young, I was a Highland dancer and we were always told to hold our belly in. So if you're not allowing your belly to go through that natural breathing rhythm, we're still going to breathe. Our bodies are designed to survive, but we need to breathe diaphragmatically in order to thrive. So if I'm breathing this way, You can see my chest rising and falling. That's me breathing from the muscles of the upper chest. And why this matters is because at the base of the lungs, right down and through here, is where the majority of the oxygen receptor sites reside. They're called alveoli. So when we're breathing through the belly, we're pulling the air deeply enough into the lungs to create the most optimal absorption of oxygen. And in fact, it was in Stephen Cope's Yoga and the Quest for the True Self. He said, when we're breathing diaphragmatically, we can feed the body up to 600% more oxygen. When we're breathing through here, we're not pulling the air deeply enough into the lungs to reach that. So we're not getting the absorption. And in 2014, they did a study in Australia. It's actually a TED Talk where the gentleman shared that 84% of weight loss comes through proper exhalation. And that's because of the detoxifying effects of the body and the heating of the body. Because think of fatty liver disease. It's something that's on the rise for people. So we've got this liver, this massive organ right here. It has so many functions. One of them is to clean the blood. So if we're breathing properly, we're getting this constant movement and heating in through here. When we sit and we collapse, like most people do, again, this area becomes frozen. So one of the functions of the liver is to break down fat. If you think of butter at room temperature, it's a solid. If you put it in the frying pan and heat it up, it becomes liquid. So we want the fats in the body to be liquid because they're carriers of nutrients into and out of the cell. When they become solid, they just become a roadblock. So the fact that we're not breathing properly, in my opinion, is the biggest reason that fatty liver disease is on the rise. And of course, diet matters. We don't want to be eating bad fats. We want good fats. We want all good food and nutrients, of course. But I truly believe it's more because of the whole freezing effect that occurs from breathing through the muscles of the upper chest.
Well, I, for one, certainly didn't know that I could lose weight from breathing. So that's just made my day. Clearly, I got to get some technique with that. But 84%.
I know. I was so excited when I learned that.
Oxygenation, which creates flow, which creates then innovation or I don't know, optimization of the cells, which warms them up metabolically, which means they're doing that liquefaction thing that you're talking about with the fats, which then it's just gonna like vanish.
Well, too, I mean, we talk about metabolism a lot, and we believe that as we get older, our metabolism slows down. But what's really happening is the older we get, the more time has accumulated inside our bodies, the more adhesions we have, the less cells that are getting the blood and oxygen flow. So as we start going through this process of fascia decompression is the general term that I use for what we do. Block therapy is the self-care version of fluid isometrics. So it's all, the science of getting into the fascia and putting the space back. But as we go in through those layers and we start melting through those adhesions, we then awaken cells previously blocked. So our metabolism begins to increase as we get older, which is fun.
Can you speak to some other conditions or symptoms that the breathing, the posture, the block therapy is useful for? So we've talked about kind of the psychological aspect of trauma. We've talked about, some kind of a physical trauma, but I would imagine that this is obviously the resistant weight loss, but I would imagine that this is more or less relevant for everyone because we all exist in the world that we exist in, right? We all are either right-handed or left-handed. We all have kind of patterns of movement that we go towards, and we've all, I'm sure, been in some kind of either imbalance, right? You mentioned it starts at the feet and the ankles and the calves. So can you just bring this into perspective, maybe sharing who it would be beneficial for, and what are some in your clinical experience, what are some kind of amazing transformations that you've seen personally?
Oh, there's so many. And what's really interesting to note is fascia literally innervates every single tissue in the body: bone, skin, nerve fibers, blood vessel fibers. So it's not just this casing around muscles. It literally is what holds absolutely everything together. So then when we take care of our fascia, absolutely everything that can go wrong can also turn around and go right. And one of the things I see so much of, and I really see the significance of the limbs being the factor, is scoliosis. I deal with scoliosis all the time, and people think it's a function of the spine. The spine is the result of the limbs getting torqued out of alignment in 4 different directions, literally, and how the spine has to adapt to those forces, because fascia, again, 2,000 pounds per square inch is what it can hold our body out of alignment with. Like, that's a crazy force. So because the limbs are the furthest from that engine, again, that's what we really have to pay attention to with structural things. So that has implications on anything low back related. And I mean, there's so many issues that can occur in the low back, from sciatic pain to slipped discs to spondylolisthesis. I mean, there's a number of things, but they really all stem from an imbalanced fascia system, and how the body is having to respond through creating false walls and false floors, essentially scar tissue, to create that stability. So the more of that stability has to be created, the less mobility, the less flow. And then we become these frozen bodies that really have very little movement in time. I have a couple of my community members, I get so excited about this, huge changes in Parkinson's. And one of the really exciting things happened with one of our members who's been now in it for 3 years. About a year ago, I shared my hair health class so that we could release the scalp from the skull to improve blood flow to the hair. But he started seeing these amazing changes with his neurological symptoms. And today his dystonia is almost non-existent. So that to me is just so very exciting. Any age, any individual, any condition. So whether we're talking weight loss, we're talking anti-aging, things like cellulite. So again, the body is just designed, the fascia is designed to support and protect us. So you'll notice when you stand, you probably tip over to one side, because again, we're dominant on one side. So unless we're conscious of not doing that, that's going to be our fallout. So the fascia will grip and adhere to the bone in that spiral fashion. And that's what creates the dimples. More importantly, though, that's also signifying that there are blocks to flow on the other side of those adhesions. So that's going to impact whatever is on the underside of it, the knees, the feet, down the road. So pretty much anything and everything, whether it's brain health, if we're not getting that proper flow to the brain. I deal with a lot of people with concussions. And the thing is, if you approach the head after concussion, you're going again after the issue site. We want to address the breath. We want to make sure that we can pull away the negative consequence of the injury. Just like a car crash, there's going to be debris. You got to clean that debris out to create room to get the good stuff in there. We deal a lot with acute injuries where, I mean, fractures are getting healed in 2 weeks, not so much longer. I've got a couple of really cool YouTube videos of a soccer player and a rugby player who both had one had a Jones fracture and one had a really bad fourth metatarsal fracture. And the first one, this was actually very exciting for me because it was the first time I dealt with a fracture. And so I was applying the concepts of everything that I started to learn. And I'm like, okay, I've done this all with soft tissue, but now I'm looking at a bone. But to me, it's all the same thing. It's all fascia. And he had come to my clinic day 6 after his fracture. He was told not to weight bear for 4 weeks, but he was playing in 3 weeks and he played with no pain. So there's a whole video series around what we did and the changes that he made. And it was really exciting. So really there's nothing that this doesn't help when you understand the fascia and the simplicity of how pain, aging, and disease, and ultimately death occur in the body. And it really is through compression. So connecting to that full exhalation is the counterforce to gravity, because every action has an equal and opposite reaction. So when we're really exhaling properly, we keep our body elevated and aligned so that gravity doesn't have that negative effect to pull us down and take us through that demise that we all think is just a normal part of our existence.
Your YouTube channel, you have some incredible information and little like trainings and strategies. So we'll definitely point folks there, because the case study sounds really amazing to really see that in real time. One other aspect that I wanted to point out, because my specialty is gut health, so I'm always bringing it back to the gut. These adhesions really can affect the gut and can actually put folks at higher risk of certain conditions. So for example, overgrowth in the small bacteria, we call this SIBO. The adhesions, if you think about two tissues kind of connecting, you can get adhesions actually inside the intestines, or the intestines it kind of gripping to something else, another organ in the body or another part of the intestines. And this can actually put you at risk for bacterial overgrowth in the gut. So this is so relevant on just literally every single level. of health. And really, it seems like all organs, when you put together the fascia, the breathing, the posture, kind of all of it. And so I really appreciate that your approach is not just looking at one aspect, but it's looking at all of these aspects that are so interconnected that it's almost impossible to tease it out. I mean, you mentioned concussion going to the brain, but you're like, well, you have to be breathing first, which makes sense. We're all doing it all the time. And I think maybe that's why we don't think about it very often, because we're just doing it unconsciously. But like you said, it's incredibly, incredibly powerful.
Am I able to screen share? Just based on this, I'd love to share something if I can screen share.
Yeah.
Okay. So this was 2 months. This is a thermography image. And the person before had not started blocking. And then 2 months after, that's the thermography after blocking. And the red and the white basically show areas of high inflammation where there's really no flow. There's all this stagnancy. So this is gut health, as you just explained. It's this overgrowth. And then after just 2 months of blocking, to have that kind of change, the thermographer, Tammy Coldschmidt from New York, who took these images, she said she's never seen a thermography image so impactful in such a short period of time.
That's incredible.
I love these kind of diagnostic images where you can literally see the effects. Like, it's one thing to be the patient and you can feel that, oh yeah, that's a bit better. Oh, I like that. But for everyone else who doesn't have that particular person's body, to look at it and say, yeah, well, there's no argument here. It's obvious.
Wow.
So just a little side note.
Yeah, thank you for sharing that. That is so powerful. And you think about just what all that inflammation is doing in the body, you know, when it's there. And so you said this individual was doing the block therapy.
Yeah, so 2 months only. So that's the nice thing too. It's so immediate, the sense. We always share in our very first class to release the rib cage, because even the ribs get sealed with that 2,000 pounds per square inch force. So here's this plate of muscle that essentially now has become folded over on itself. So even if we do breathing techniques, we're not able to release this. So we can strengthen what we have access to, but we want to release and open and free that muscle so that we have full access to it. So the first class, people typically will feel that difference. They'll notice that they're sitting up taller. People often mention that they have to change the mirror in their car if they've been at a live class, because you're sitting up taller. And again, just that immediate sense of calm, because you're tapping into that parasympathetic nervous system with that full exhalation. And from there, what's lovely is, if you think about the aging process, think of a balloon fully blown up. It's round, it glows, it almost defies gravity. Take half the air out, it becomes a rubber, wrinkled thing that can attract dust. It becomes heavy. So that's what happens to our cells as we age if we're not conscious diaphragmatic breathers. We lose that lightness inside. We lose that glow, that roundness. And that's why skin ages, but it's why everything ages. But we happen to see it on the surface. So we can undo what time has done. And actually, it was really fascinating, because I guess it was last April, we did a 21-day head, neck, and face challenge. And the befores and afters, and they're on my website, they are truly spectacular. And it's not just about improved skin tone or lifting. Literally, the shape of the skull changes. And this is really important, because if you think about, you know, if this is how I sit all the time, and I'm doing this for 20, 30, 40 years, my whole life, gravity over time is going to slowly be manipulating absolutely every fiber in my body. So as my skull starts to change its shape, now the contents inside, just like the lungs and the heart and the rib cage, become affected, same as in the belly, so does the brain. So as we start to really position these bones back, then we can start bringing the brain lobes back to life that have ultimately been blocked from flow, because they're just not getting the blood flow because there's compression there. So by decompressing these areas and then strengthening this breath, the body knows what it has to do. And it is so fantastic at regeneration when we give it what it needs. And it's a simple process. I don't believe in disease. I'm not, and it's funny because I say that. And of course, for people that are struggling with like horrible things, I understand how that sounds. But what I understand is that the tissue in the body is riddled with scar tissue or adhesions that block flow. And whatever tissue is being blocked from that flow will share symptoms. And if those symptoms aren't addressed properly, then they'll continue, and eventually they'll get pulled so far away from their energy source that they'll essentially become non-existent as a functioning part of our body, and it becomes tissue that we end up having to slug around. So for people with MS, for people with fibromyalgia, whatever it is, that can be reversed. And I have people in my community and it's happening too all the time. And it's not just for people, it's also for animals.
Yes, we are going to get into part 2, talking all about, I'm so glad you said that, talking all about how this relates to our pets. So I'm wondering if we can move towards some practical strategies, because at this point, I feel like probably everyone listening is like, okay, Deanna, you've convinced me. Okay, but now what do I do? Where do I go from here? How do I know if I have adhesions? And how do I know where to target? Do I use my hands? What do I need to do from here?
Well, we have a gift for everybody. And what is so nice is you can literally download it and start immediately. So it's a 9-day program, and it's a sampler of what our starter program is with the blocks. Now, I just want to say the reason that we use these specific blocks, they're made the way that they are, is because these are from bamboo. We've also used and do use wood. This and bone are similar in density. If you have like your fascia roller, for example, it's going to be more porous. So it's not going to get to those layers. And again, the goal here is that we get to the bone, and they're very specifically shaped as well. Now, having said that, this sampler program that we're offering for everybody, we teach you using a rolled up towel, and we show you how to roll it up nice and dense. And that alone gives you so much benefit. We've had people join our teacher program just from the sampler program. So you can get it immediately. And I would just recommend start, because you're going to feel that change right away. And all you need is a towel at home, and you'll be able to follow along with my nephew, Quinn, and I. He's my partner in crime in this whole journey. And we do the videos together, and we demonstrate everything really simply, and it covers the whole body. So you'll get this understanding, and right away you're going to notice the change in your breathing.
Wow, that is an incredible resource. Thank you so much for sharing. And who doesn't have a towel? So it's a great way to start. And that's really interesting that a soft towel can make so much impact. Can you speak?
It's the rolling it up so that it becomes quite dense. It's all about the density. We don't want to be like melting into it. Well, actually we do want to be melting into it, but we don't want the towel to be moving. We want to, we also say you can use a book, but we show you how to roll that towel so it's nice and snug and firm. And we stay in each position for a minimum of 3 minutes, because we're not just in position in and out, and we're not rolling around. We are literally planting in to the fascia, connecting to the breath. When we start breathing diaphragmatically, we turn on the body's internal furnace. When we breathe through the muscles of the upper chest, it's like a space heater. So we start heating the body from the inside, and then pressure over time on the outside creates heat. So we become really effective in the positions at getting through those layers of adhesions. And we teach you also how to use pain as your roadmap, because all pain equals is adhesions. The body shares pain because it's your cells letting you know that it needs attention. And pain is not a bad thing. It's the language of your cell, like the baby crying. You don't ignore the baby crying. You give the baby what the baby needs when it's crying. And our cells are the same. It takes a little bit to understand the language of the cell, because we haven't really been taught this, but it's your cells, and you become really intuitive with what your body needs when you start tapping in, diving through those layers, and connecting to those deeper cells of yours.
Amazing. What I love about your approach, Deanna, is you focus on empowering people with the knowledge and the tools to do it themselves. And I think that's really unique, whether it's a towel, whether it's a block, whether it's your hands. This could completely change someone's health. And, we have a lot of people in our community who are doing a lot of the foundational things already. And yet some people still have their own health struggles. So this is a really unique angle that I hope is really resonating with folks and giving them some hope in terms of if you feel like you're having some stubborn issues, this is likely a route that is going to be helpful for you. If nothing else, it's going to be helpful all around, right? So, and hopefully for any specific stubborn symptoms or pain, things like that, which just really, really affects quality of life.
Well, it really does. I mean, I've had lots of pain in my life, and it's very hard to find joy in a moment when you're focused on that pain. It's such an energy sucker, and it really does take you away from the moment because it does impact that breath. So what I love about my community, and for anybody that wants to join, we have a private Facebook community that's free for everybody called Block Therapy Community, almost 10,000 members. So if you ask a question about a specific issue, you're likely going to have somebody in that group sharing their perspective and how blocking has benefited them or addressed their issues. And that's what is so very exciting about the community. It really is like the wisdom of all of this practice, because I mean, I can say whatever I want to say, and I've had my own and many issues that I've worked through, but for others to share that for fibro, this is a way that they can really manage and improve what's going on. And then for Gary to have shared about Parkinson's, like that is what is so exciting about this community group. And it's very empowering. And really that's what this is for me. It's once I know that people have connected to their diaphragmatic breath, your view of your body changes, your view of life changes, and most importantly, I believe your view of pain changes. I get so excited when people reach out and they're like, oh my gosh, I just had a rib release, which is something very specific to block therapy that can happen. And it can often come with pain, like most healing crises can, and they're excited about it. They're not afraid of it anymore. And they're like, I haven't had one yet. When am I going to have one? So, and not everybody does, but it's really neat to see people changing their perspective around pain and actually embracing it for the information that it provides for us and the direction that it provides for us to get out of our healing. It's our body giving us that insight that we need to put a little bit of time and attention here. And if we do, and we do it in the right way, we can reverse pretty much anything negative, in my opinion.
Incredible. Well, we will absolutely link to your Facebook community, and we'll share the link so folks can get your 90 challenge and start diving in. And would you mind sharing about the raffle?
Yeah, we're offering our starter program we've got 2 sizes of blocks. I initially started just with this one for adults. So basically people over 5 feet, this is the guaranteed one you want. For people under 5 feet, we started with this for kids, but now I have all these double blocking classes. There's multiple benefits of having both. So we will provide both tools as well as all of the information to our starter program, which gives you 9 classes that you have lifelong, covering the full body, plus a whole bunch of additional information, as well as a 2-week free trial into our Block Therapy membership. And that's where we have so many guided programs. We have our trauma program. Right now, we're in the middle of a 21-day Lengthen Your Core program, which is just fantastic to really strengthen and tap into those psoas muscles. We've got something for everyone. And we make it really simple by day, where we release through a class, and then we rebuild through a postural exercise, a foundation training exercise. And we go day by day so that we're not missing any parts. And we make sure that we address those cause sites. So we're not that you'll be wasting your time, but not running in circles a little bit. We want to be really efficient with people's time and healing.
Incredible. And for folks listening, I had sent Deanna an email like, oh my gosh, this raffle's amazing. But also, what about folks who aren't in the US? And you came back and you're like, they can live anywhere in the world. So Thank you for that. And folks who are not in the US, you can absolutely enter the raffle as well. So, okay. We've talked about the incredible benefits and importance of breath, proper posture, unblocking the adhesions, and really taking care of the fascia. We've talked about how people can get started in terms of with a towel at home, and if they want to go further. Is there anything else at this point that you feel like, you know what, anyone listening, it's really important that they need to know this? Anything that we haven't given you the space to talk about, or that's just kind of speaking to your heart right now?
Right now, I just started my partner fascia release program, and I created this because if you look at the people in my community, I would say 90% are women between the age of 45 to 75 years old. So I have a lot of women saying like, my husband just won't get on the block, or my kid won't get on the block. So I created this partner fascia release program to teach you how to use your body weight and gravity on your partner in a really, really simple way. So you're not having to exert any energy. And It is so fun and exciting, so simple to do, and it really connects you to your partner. It allows you to learn different modes of communication with each other. And again, the benefits are really astounding, and it's just so simple. So that's another thing that I just get so excited about, because I just want everybody to learn how to breathe.
I absolutely love that. And you know what? Sometimes, I mean, for one, if something's really powerful, you want to share it, right?
Yeah.
You just so want to share it. And then two, sometimes it can be hard to integrate a new routine unless you have someone doing it with you, and it makes it more fun and holds you a little bit accountable. And just sometimes it's not even like, oh, I don't want to do it. It's just like you forget, right?
Yeah.
And bringing in someone else that you live with, that's a part of your routine, the bonding, the routine of it, all of it. I absolutely love that. Oh, I'm excited to check that out. Well, everyone stay tuned for part 2, because we are going to dig into Deanna's work with Dr. Marlene Siegel and what they are doing when it comes to animals. So really excited to dig into this. Deanna, before we go there though, can you share where folks can find you? You mentioned your YouTube channel. Can you share about your website, all of the above?
Yeah, our website is blocktherapy.com. Nice and simple. And you can access our YouTube channel from there, also Facebook, Instagram, whatever else. I'm not a techie person, but it's all there. But there's tons and tons of information on blocktherapy.com.
Amazing. I'm going to put a plug one more time for your incredible YouTube channel. So we are going to put all of those links and resources here, again, along with where you can get your 9-day challenge and enter the raffle. So thank you again, Deanna. Looking forward to part 2.
Thank you so much.
Welcome back, Deanna and Dr. Marlene. This is our first 4-way conversation.
Well, we're honored to be the ones to include in that. Thank you so much.
Yeah, thank you.
Well, we just did a really amazing introduction with Deanna to fascia and adhesions and posture and breath. And we focus primarily on the human side, but we're going to kind of switch gears now and talk about what this means for our pets. And I have a feeling there's a lot of overlap here in terms of principles.
Absolutely. Deanna, you want to start off and then we'll talk about what we're doing?
Yeah, sure. So when I started really understanding the world of fascia, I started recognizing how everything in the universe is a mirror of itself. So of course, if fascia connects us as humans together, it's also going to do the same with animals. So I don't have pets myself. I actually have some allergies to animals. Otherwise, I'd have a bunch of them, but I have worked on them. And it was beautiful and fascinating to see how they literally acknowledge the work and they surrender. And I think what's really interesting to note is, as humans, we're bipedal. So we have to deal with gravity in a very different way with how we breathe compared to being on all fours. So what I've observed personally, and now since I've been working with Marlene, like absolutely 100% true, animals integrate breath and posture almost immediately, where we as humans, because we get caught in this freeze response of fear. Even myself, for example, if I have hip pain and I'm on my block and I get up and I've been in pain for a while and I start walking, my brain is going to take me back into that negative posture because I'm expecting it or anticipating it. Where what I've really observed with the work I'm doing with Dr. Siegel now is that animals don't think that way. They just get up and they start running or walking, and they breathe, they integrate so much faster. It's like there's no ego to deal with. So it's absolutely fascinating. They respond quickly. And I am just so grateful, Marlene, that you reached out to me, because I was waiting for the right person to put this together, and you were it.
So we met through the Holistic Leadership Council, and the moment that I experienced her block therapy, I knew we had to include the animals in on this. And I wasn't sure what that was going to look like, because I wasn't sure how we were going to use a block on an animal. But I said, I got to do this. And I was already into lymphatic and fascia. So this was just a perfect segue. So as we started talking, we decided to make this extension something that the pet parent will learn to do on themselves and on their two-legged family. But then once they understand it, once they can do it on themselves, now we can extend that for them doing it on their pets. And that's super important, because they're around the pet way more than the veterinarian or the veterinary staff is. So they can actually work on this animal literally on a daily basis. And with our supervision and our coaching them on what to do, they can affect these changes. And like Deanna said, it is so incredibly fast. At first, when she had me doing the different animals that we were doing, she would say, oh, hold it for 3 minutes, 5 minutes. And we're finding that these animals were melting in 1 to 2 minutes. Like you could literally feel them relax, and you could feel their breath get bigger and wider because they were in training to my breathing, which is really cool because she had to keep reminding me, take deep belly breaths and relax. So the more parasympathetic I got and the deeper my breathing got, the animals started mimicking my breathing. Some of them literally pacing themselves with me. It was so interesting. And then we would see things on them, like Deanna, we're doing it on Zoom. So she would look at the animal and she would see where there were divots or there was a distortion or the hair pattern was different. And she would have me work on these specific areas and I would get done in 30 minutes. We had a literal transformation in these animals. So I am super pumped. I am super hooked on this. I do it on myself. And now I'm finding myself even taking the time to do it on all of our patients.
Can I just share the one with you with your cat? Because that was so amazing. We didn't know if the cats were going to be, as open and allowing as the dogs. And I mean, it was just so beautiful because your cat is 20
Yes.
years old.
Yeah.
And you said not very lovey and whatever. So literally 45 minutes, this cat was on Marlene's lap. She has her fingers diving into its belly. And then it did one of those like on its back and hugs. And I saw her expression because she's like, he's never done this.
We have it on video. Like it really happened. Yeah. And I think that's something that we've seen on all the patients. At first, they're a little tense and they're a little worried about what's going to happen. And maybe they don't want to hold still. But then as I relax and as I do the work under Deanna's guidance, we're just seeing these animals literally just melt. I don't have a better word for it. I can feel the tissue relax. I can feel the muscles relax, and they're just happier. Plus they move better and they look better and their literal hair patterns change. It's remarkable.
Wow. Where would people look to see an irregular hair pattern that would be the clue that there'd be some adhesion or sticking point there?
Like a cowlick in your hair. It's the twists. So if the fur should be aligned and you start to see the fur, get entangled, twisted. You can also see where in the rib cage, for example, there might be like a collapse and then a ballooning. These are all things that we see in people, but again, it all translates the same into pets. Marlene, can we talk about the other little puppy? That was just
we have so many. I want to mention one more thing though, the asymmetry. That's something that an owner can see pretty readily. And if they take a video of their animal moving in slow-mo, the cameras do that now. If you take that picture in slow-mo, you can actually see the difference in the legs, like which one goes up underneath, which one hangs out in the back, are they pacing themselves the same? So those are all clues, but honestly, any animal that is not feeling good, isn't acting right, isn't eating well, has had surgery, has had any injuries, they're all candidates to have this work done.
Even the tail, which side the tail will fall to, that's an indication of the asymmetry. If you have a puppy with an ear that's down, that's another indication. All these things.
We did one. We had a puppy and I got done working on it and the ear stood up. If it wasn't on video, I wouldn't have believed it. It was crazy.
I've always wondered why sometimes there's one up and one down. It's really cute. And I was like, I wonder why, but I never really had an answer for that. That's fascinating.
Yeah. Deanna, which case did you want to have us talk about?
Ellie, correct?
Ellie was the dog with
paralyzed one.
Okay.
With the back legs, the one that we just worked on last time.
Yes. Okay. So this dog came in, she had a degenerative disc disease and she was fully paralyzed in the rear end. We started working on her and I think we just had literally gotten done and she was able to stand and take steps. And then we did our other things as well and had the owner improve the diet and do all those other things. But you could see the changes in her body, the physical changes in her trunk was remarkable. And she was walking in under 48 hours, fully walking
Oh my
under 48 hours.
gosh.
Yeah.
And,
So
and just for viewers who don't necessarily know the prognosis and symptoms of this condition, can you just say what would be a normal?
This was an amazing case because the owner had taken, Ellie became paralyzed suddenly. She literally was just dragging her back in like she was a seal. And she had taken Ellie to her veterinarian, who was exhausted by the time they got done with the steroids and everything. They had nothing else to offer. So she made it all the way to a surgery referral center, and they were going to do surgery on her back, but her blood wasn't clotting. And she was starting to have bruising where they stuck her with a needle in her neck. And so they were like, okay, we can't cut on this dog because she's not clotting. There's a problem here. And then they started giving the poor mommy this list of all these different diseases this dog could have. And they put a urinary catheter in, and she's bleeding straight blood. It was a hotbed mess. Deanna and I just took a deep breath. And I talked to the mom and I said, let's just work on one thing at a time. We're going to work on the inflammation. We're going to work on releasing the blockages of the energy so that we can get things moving again. And we worked on chiropractic, lymphatic, and all that. And radiographically, her spine looked like a C curve, like it went like this. And when we got done day one, her spine was straight. I mean, we have data to prove how effective these treatments were. And then by the end of day one, she was actually getting up on her back legs. By day two, she was walking across the floor. Day three, she took her own urinary catheter out at home. She just pulled it out. And then by day four, she's walking. She's literally walking and running all over the place. And all the bleeding stopped, all the bruising stopped, all the other things went away. We got her diet nailed down. We got her nutrition nailed down, just the principles of how the body biologically works. And it was for a fraction and didn't have to have surgery, never had any steroids, right? None of that.
And then it was last Wednesday when we were working together with her. And that was when I said, how long has her ear been that way? And Marlene said, since she's known her. So then I had her doing some work on the head, and she jumped down and she did that integrative shake. And then suddenly you saw, and then it was up.
Went straight up. I mean, ladies,
and this is on video. We have this. Yeah.
It's remarkable.
Send us some of these videos if you want to share them. We can share them with folks who are listening.
Okay, I'll have Jorge put the video together and
Amazing. Oh my gosh.
Yeah. So I think the part that we really want to get across to people is that the body is this amazing regenerative machine. It really is. And when we can do the things that allow the body to go back to do what it knows how to do, and we get out of the way, we provide the elements it needs to work with, and then we do the things that structurally allow the body to energetically reincorporate and do what it knows how to do, it goes back and does it. But like Deanna said earlier, the animals are so cool because they don't have an agenda. They just go, oh, I feel better. My legs work. Thank you. And they just go.
And they go off and have play and live their life to the full. Exactly.
Yes. And they live in the moment, which is something we all should learn how to do, is how can you just have joy and gratitude and peace for right where you're at? And that was Ellie. She was the happiest little dog, no matter what you did with her. She was just a happy dog.
One of the things I think was so fascinating too, Marlene, was I was mentioning to you about my sister's German Shepherd and how hip dysplasia was such a common thing. And you had mentioned that was maybe 20 years ago. And now you're seeing more stenosis of the spine. Is that correct?
Spondylosis.
Spondylosis of the spine.
Yeah. So we're getting a lot of arthritis in the spine. Yes.
In the spine. So there's been a shifting of where there's been a stress. And I've also noticed the same thing in the youth. There's been a massive shift in the posture of the youth. So I really feel that it's largely, there's many, many factors, of course, but again, the nature of how stressed we are in this world, and our pets are naturally adopting our breathing pattern. And that's also why I believe when people say we start to look like our pets or our pets start to look like us, we're living the same frequency of energy inside our space. So that frequency has a face. And that's why we can start sharing these similarities to whether it's other people or animals and people but also the breathing pattern, which was just so significant when you shared that with me. I thought, wow, that's amazing, but how we can also still turn that around.
Absolutely. That was so beautifully said. One thing I just want to make sure that we get across through the summit is the emotional status of the pet parent. And this is not to put blame, shame, or anything on anybody. It's just to be aware that when we have pet parents that are so fearful and so anxious, and they have so much emotional attachment to losing that pet, they are adding to the challenges that we have to overcome. And it can really make it so difficult that it may not be the outcome that we're looking for. So I would ask that pet parents look in the mirror, take a deep breath, and ask yourself, what is my main emotional driver? And it may be that this pet is bringing you to a moment in time, a place for you to look at what is it that you're really fearful of? What is the real emotion behind it? Is it something you've experienced over and over and over again? That's what needs to be addressed. And then we can handle the animal.
It's a really important message. Thank you for sharing that.
You're welcome.
Folks who are listening I'm one of them. I'm like, okay, can I start now? Like, where do I start? What do I do? What do you recommend? How can we, is anyone else doing this? I feel like you two are pioneering this.
Yeah, I don't think so. I know there's nobody doing even my pet parent program. There's nobody putting it all together. And now when we add what Deanna and I are doing, it's a lifestyle. It is not a pill for the ill. It's not a diet for the disease. It's a lifestyle. So we would ask that pet parents start with, are you doing the things that are going to help this animal have longevity and have vibrance of life? That means species appropriate diet. That means making sure all the essential nutrients are there, that you have a healthy gut, not a leaky gut, that you have all the organs of elimination open and working, that we have good mitochondrial activity and reproduction, and we address the trapped emotions. And then we come back in and we start fine tuning the things like fascial release, like doing the fluid isometrics that we're going to be teaching pet parents, and they're going to learn to do it on themselves. So as they're healing and going through their healing journey, their pet is guiding with them. Isn't that amazing?
And I just want to share, Marlene, that already we have offered as a free gift to everybody listening the sampler program using a rolled up towel. So I would recommend for anybody interested in learning with your pet, start there. And then if you are wanting to go to the next stage of beginning with the starter program, that will be a part of our pet program. So you can get started right away on your own body. And then if you already have the starter program, there will be a discount for you for the full program once we're ready. And we're believing by the summertime, we'll have this pet parent program all set for everybody to enjoy.
I would highly recommend, absolutely 100% endorse that people start with the block program, because I started with it and I was amazed at the things that were happening in my body. And I considered myself pretty healthy, but I could feel major differences. In fact, last week, my lovely Echo bit me in the arm. I mean, really bit me in the arm. And Deanna was helping me on about day 2. I didn't have a lot of swelling because I was doing laser and a lot of my therapy, so it wasn't as bad as it could have been, but she did a good 45 minutes with me doing block therapy on my arm, and I was normal the next day.
Wow.
Which for a cat bite is impressive. I don't know if people who haven't been bitten by a cat know this, but there's all kinds of crazy stuff in the cat microbiome.
Right. From here to there, he was wide open and nailed me. And I never went on antibiotics, ozone topical, ozone rectal, my frequency machines, Deanna working with me on the block therapy because it was moving the fluid, helping to increase circulation and melt down. So I never got adhesions. It was really remarkable. 4 days. 4 days healed, done, full use of my hands.
Incredible. Yeah. I wouldn't have thought of it in the context of something acute like that, right? I'm thinking it more along the lines of a chronic condition, but that's so powerful. And I would imagine then that we could think about that for our pets in an acute setting too.
Actually,
Well,
when we have acute injury and we have the inflammation, that's when your body is most primed for healing because of all the gold sent in the inflammation for the healing. So if we know what to do with that inflammation, it's actually a huge opportunity to heal a whole bunch of things really quickly.
How interesting.
and think about the fact that living is going to create a degree of inflammation. We move, we breathe, we bump into things. It's just normal day-to-day activity. You're going to be exposed to toxins. And so being able to do programs like block therapy and the fluid isometrics are part of a wellness program. We're so conditioned to wait till we break and then we go and try to fix it. But if we were better at being proactive and being healthy, then a lot of these chronic illnesses that we're seeing in people and pets, we could actually prevent them or minimize how severe they become because we're proactively helping the body to do a better job.
That's such an important point. And, you know, we need to weave that into our daily life so that we can be sort of disease resistant. And then if we do get unlucky with an injury or some other circumstance comes up, we're primed to be able to, as you've just demonstrated, just heal almost at the speed of light rather than this being a protracted, painful existence that just drags on.
Yep, no longer a victim. When we take control, we become the victor of our body. So my daily routine when I get up, infrared sauna, and I do my block therapy, which I always do my abdomen. So I'm making myself do these deep belly breaths and opening my diaphragm and going into a parasympathetic state. It's remarkable. Just little things like that. And it takes me all of 45 minutes.
Wow. Wow.
Okay, can you give us a couple more little insights about the pet program? Like, what can we expect? What does this look like? I know you're still fine tuning, but you're teaching us pet parents how to do this on our pets and create, like you said, create just kind of like a lifestyle routine around it? Are there going to be literal blocks involved? Are we using our hands? What does that look like?
Want me to share? So I shared on our last call how I have a hair health program. So we want to release the scalp from the skull. So we teach you to basically take your fascia and to create that energy in the tissue so that it becomes heated and no longer sticky. So it's a combination of how to grip and pull and twist at a very specific pace, how to create pressure in certain areas where there's ballooning, how to use your fingers in certain areas to release those deeper adhesions between the ribs or in the joints themselves. And we've actually created a specific protocol to follow, because this has been so exciting for me too, because what I've really learned is just like people, there's some very common, obvious cause sites that are universal, and then there's unique things per animal as well. But so we've created a very specific protocol to cover the body and to create this amazing release so that there's integration and health. So you use your hands though, and we've worked on both the big, the small, and the cats so far. So Marlene is actually coming to see me in Winnipeg end of May, and we're going to do all of our filming and put this all together so that you can all have it as soon as we can have it for you.
And I imagine, Deanna and I haven't talked about it, but I know you have it in your other programs where there's, whether it's a monthly call or something like that, where pet parents are going to be able to call in and ask questions and maybe a little guidance in there. So there may be like another program that they can join, a membership program where we haven't even worked it out yet, but that's what I envision. Because sometimes there's other questions that people are going to have, and watching a video takes you a long way, but it may not take you all the way. And I experienced that in block therapy. When I was first doing it, there was a few questions that I had, and I was fortunate enough to be able to ask the pro what the questions were. But it helps when you're a part of a community. And that's what Deanna has built for her human side, is this huge community of people that are so gathered together to help each other. It's that giving and receiving. It's the law of reciprocity. They're out there helping each other and helping themselves, and then sharing what they're doing with others that don't have the experience. And it's just really helping people to live that healthier, longer, more vibrant longevity with quality of life.
Beautiful. Well, tell us how we can get on the waiting list. How can we be alerted as soon as it's available?
Well, if people download the free gift, you'll be on our mailing list. And as soon as we're ready to share it, you're already going to have all the information, and it will come in an email, and you'll have whatever you need at that time.
Well, it can't get easier than that, can it?
Yeah. And then if they do our pet parent program, then they'll have all of their nutrition and detoxification. They'll understand, they can put in place a lot of the things that they need to do, part of lifestyle, so that everything will be more successful going down the road.
So it's really the complete package. We're focusing on a new modality that has so much potential, but making sure that the foundation's there, that it's sustained and has the most efficacy. I love it.
Beautifully said, Penny. Thank you.
Well, thank you two so much for sharing this incredible resource that's going to be coming. And just thank you for doing what you do. I love to see this new kind of branch and marriage of both your unique specialties and bringing them together to create something that literally no one else has created. So we will absolutely be sharing with everyone as well when it comes out. We're going to be spreading the word. We're going to be shouting from the mountaintops. We're going to be joining because we are just so excited to spread the word.
But you have an amazing audience. So kudos to you ladies, because you're bringing together the perfect group that are very responsive and really want to do the right thing, and they're willing to put the work in to do it. So thank you so much.
I'm sure they massively appreciate the creativity of you guys to just not settle for, well, first of all, not settle for allowing suffering, but then secondly, to say, do you know what? I have this incredible thing over here. I have this incredible thing over here. What would happen if and just to pioneer with so much optimism and exploration, because I feel really privileged that we're really on the cutting edge of what you guys are doing. And, no one else is doing this. It's just about to launch. It's a real honor actually to be like one millimeter involved in that. Because it's going to change everything.
Wow. Yeah. Thank you guys. That's awesome.
Yeah. And the part that I love the most is that we really are empowering the pet parent to be in control, because everything we're teaching our pet parents, they are responsible for doing. They're implementing it. They're carrying it forward. They don't have to rely on anybody from the outside to do it for them or become dependent on somebody else. They're in charge.
That's so key. And of course, you can then harness the beauty of the relationship that you have with your pet. You're not having to bring someone who the pet doesn't know in, or someone that the pet doesn't like, because they've been conditioned to learn, oh, I don't really like my pet so much. Right. So yeah, that just increases the bond and all the good things.
Well, my blessings and thanks to everybody. Deanna, I'm so grateful to be working with you. You are a master at what you do. The world is so gifted with your program. And Penny and Katie for getting this message out. I know it's a lot of work to do these programs, a lot, in a lot of expense. So thank you for being the torch and the leader and lighting the path.
Thank you, Marlene, for this, because this is amazing. And also, yeah, I'm very excited, Katie, when we first connected and you were mentioning the whole community, that just excites me so much, because as I mentioned, my community is really the life force of this whole thing, and to be able to continue with that and then listen to what people are needing and provide the platforms for them. That's really what we're going to be doing as this grows, and we hear what people need. We'll do our best to implement that so that everybody feels connected.
Well, you two are going to have to come back onto our next summit after this has launched and it's tangible, and folks can be signing up and share about it again as it's further along.
We will.
Absolutely.
All right. Until then.
So
thank you, everybody.
Come on. Oh, look here. We got up a little bit. Come on. Come on. Oh, good girl. Come on. Come on. Come on. I know. You're trying. Come on. Come on. Good girl. Oh, yes. Good girl. Come here, pretty girl. Come on. I'm all the way down here. Look at you. You just walked.